Hello. I should also mention that there is surgical training, and surgical training can take 7 years or more. And so when you combine that with medical school, it can have like 13 or more years of training in surgery. Some of it, and actually much of procedural training, is like apprenticeship. You share cases with an attending and get to a point where you're competent doing certain types of procedures. Also, the term surgery is a term that has been used rather loosely, in my opinion, and may cause confusion. So, in gastroenterology, if I take out a polyp, that's called surgery. If a dermatologist takes out a small skin cancer, that's called surgery. So, a lot of the terminology is there for reimbursement reasons. I'm going to talk a little bit now about coming into the office. When you come into the office for the first time, it's important to accomplish the paperwork, and it can be um, imposing on you in many ways. But the medical history, I think, is very key. Of course, the doctors will need to get your billing information so they can get reimbursed for seeing you, and most offices will bill the insurance company, so you don't have to do that. But you want to supply your primary, and if you have secondary insurance, you need to apply that as well. Most of your practices will accept Medicare. Some of them will accept Medicaid. You have to find out if that practice accepts your insurance. Otherwise, you may be responsible for bills that come in. There also are people that are self-pay, and that means they pay a certain amount of money to see you. Um, in our office, if we were going to see a self-pay patient, we would charge what we would get from Medicare. Try to keep the costs down. There are some different types of Medicaid and different kinds of programs that are out there. And in Texas, there was a Molina program that had to do with Medicare, and it's like an HMO. They would collect money from Medicaid to cover your insurance needs. And some of those are covered and some of them are not covered by different offices. So you have to check into the details. So much of the practice of medicine has to do with the details. But anyway, coming to the office, what you want to do is have your medical information handy. I think the best way to do that is to use a computer, some sort of device that will give you memory, and then that you can change and edit from time to time and print out so that you have the latest information available to the doctor. Will save a lot of time. Also, any forms that the office wants you to fill out, you may need to come in early or do those at home so that you don't hold up your appointment or hold up your office visit. The doctor and his practitioners that are there are not interested in going through a whole bunch of questions. They will ask questions, but if you already have them filled out in on a questionnaire, it'll save time. A lot of the billing practices in Medicare, Medicaid, or other insurances are based off of how many questions you asked, did you cover all this information, and so forth. So those questions a lot of times will be there. There'll be some questions that'll just have to do with the Medicare rules, like, did you ask the patient about smoking? So you'll get a question about smoking, or you'll get a question about black lung having to do with reimbursement. Some of these are mandated by your insurance or the U.S. government or the state. So I think that's all I'm going to say for now about coming into the office.